Good day to the viewing and listening public. This is the COVID-19 update for Wednesday, April 21. I am Godfrey Brooms, and as usual on this program is the Minister of Health, the Honorable Dr. Frank Anthony. Minister Anthony, it's a pleasure always having you. Starting today off, Minister, is there any special provision to take COVID vaccines to persons who may be locked in their homes due to a medical reason?
Well, we know there are a number of persons who are at home, they're bedridden, and if the persons who are caring for them can contact the regional health officers in the various regions, then we will certainly be able to work out a way of taking the vaccines to them. We have been able to do those that have been identified to us. But I'm sure there are many more other persons. And from the side of the ministry, we're always willing to help in this regard.
Thanks, Minister. In the vaccination campaign, is government catering for other nationals that are in Guyana, especially the Venezuelans that would have fled their country due to the political and economic turmoil there?
Our policy with vaccination right now is to ensure that whoever is in Guyana, and once you're an adult, that you will get a vaccine. So that's what we are working on, because herd immunity cannot be achieved by excluding people. So we know that with the adult population, they're mobile. If they're young, they're mobile. They're, can go to different parts and so forth. And that is why we want to make sure that everyone is immunized. So migrants who are here would certainly get vaccines. Other nationals who are here working in different establishments, once they're here for a protracted period, we'll also be able to give them vaccines.
Minister, I know the vaccination campaign has been moving with full steam, and yesterday you mentioned that on average about 6,000 persons are turning up at the vaccination sites to be immunized. Do you have the number as of yesterday, the amount of persons receiving their first jabs?
So I think we have met a milestone as of yesterday, because we have exceeded 100,000 doses, 100,000 persons receiving their first dose. And this is across Guyana. We've had, people coming out, our teams going into villages. So I think the health workers who have been on this vaccination campaign has done a remarkable job for us to achieve this milestone. So I want to commend them for the job that they've done so far. But we still have a long way to go to ensure that all adult Guyanese and other persons living in Guyana receive their jab. But I think this is a very significant milestone for us all.
Thanks, Minister. Minister, April is not over yet, but it has seen the most COVID-19 cases recorded of all the months. It is also a few deaths short of meeting the highest total in the month of April. What are some of the measures being taken to mitigate this situation?
Well, the way you frame the question is as if there are new and innovative things that we have to do. We know that preventing the disease, we have to prevent transmission. You prevent transmission by, one, keeping social distancing. So you have to stay far away from people, at least the 6 feet that we've been talking about. Have to avoid crowded environments. Have to wear a mask. And if people are not abiding by these simple requirements, then unfortunately, because there are viruses that are circulating within the population, if you're not doing that, you would get infected. So people need to abide by the prevention rules that we have established. And I think once they do that, they are going to remain safe. While we're working on these preventative measures, what we're also doing is trying to get vaccines to persons. And here again, I want to appeal to everyone to come out and get their vaccines, because this, while it does not prevent the infection per se, it would also reduce the severity of the disease, which is more important, so that you would not end up in the hospital, you would not end up in the ICU, and you would not die from COVID. So that's a very important thing. So get your vaccine, and we can help to reduce the hospitalization and deaths that we've been having from this disease.
Minister Anthony, have vaccine procurement arrangements progressed with India?
We have had an arrangement with India that saw us receiving 80,000 of the AstraZeneca vaccine, but I'm sure you have been following what has been happening in India in terms of the spike in cases. There have been a lot of cases, a lot of deaths in India, and India has been working to control that, and I'm sure they will. But it is also challenging for India to export vaccines to other countries at this point in time. Our arrangements with them, we continue to negotiate, and if necessary, we'll see where those go. But as of now, Guyana has secured enough vaccine for our program, and but we continue to maintain relationships with other countries to make sure that if there's a need for more, that we can tap into those resources.
Thank you very much, Minister. You've heard it from the Minister of Health, the Honorable Dr. Frank Anthony. This has been the COVID-19 update. For more information, you can visit our website at dpi.gov.gy and our social media platforms. Godfrey Brooms is saying goodbye for now.